So from what I've read, you need to have a BMI index of over 30 to qualify for Ozempic. And at that weight category, you have a very high fat content. And again, one of the concerns with the use of Ozempic is that it's an insulin sensitizer, so it leads to muscle waste. And as a result, you lose muscle, and then, okay, you've lost weight, but overall now you have even more fat than you started off with. How do you respond to that?
See, when you try to lose weight, even with aerobic exercise, like if you run, of course, when you lose fat, and you also lose muscle, right? Similarly, with this medication also, when you are actually losing, you are losing because what's happening is because of this medication, it's stopping you to eat. So that means you will also lose muscle. Muscle loss is a phenomena which is to the tune of 30 to 40%. And that muscle loss is a part of it. But what is very important is the patient should be in consultation with nutritionist, with a doctor, because nutrition is also a very integral part of it. Macronutrients, micronutrients, they have to be taken care. It's, again, medicine is not just alone in this game. When somebody is going for weight loss, it's a 360-degree approach along with doctors and patients. And it has to be also individualized. And it has to be very patient-centric. It's not something that somebody can just go to the pharmacy and get this and do whatever and take this injection and can then further blame this injection, for weight loss. I think nutrition is very important part of it. Diet is very important part of it along with this injection. Suppose a person is losing muscle, then of course they should be taking a little more higher protein diet. And then their muscle loss will be truncated.
So lot of celebrities don't talk about being on Ozempic. And this is one of the concern areas. I'll come back to that. But what I want to ask you is that, does that mean that when you are taking the medicine, you should also be taking in a lot of supplements and a lot of vitamins to then counter the dramatic weight loss and loss of nutrients?
I think the answer which I can give is not all the patients are same, right? And it is basically somebody might have a B-complex deficiency, they might just have to take B-complex. Somebody having an osteoporosis, then they might have to take vitamin D. So they have to supplement with their individual condition. Obesity most often doesn't represent alone. Obesity often represents with other comorbidity conditions like hypertension, diabetes, fatty liver, right? Even the brain disorders, cardiovascular disease, osteoarthritis, and infertility. So it is often present with many of the comorbid situations. Many of the time, 50% of the people have got hypertension. Can you imagine? Osteoarthritis is again, range of 50% people have got osteoarthritis. 21% people have got diabetes along with obesity. So it's never alone. So it has to be taken individually with the patient. And of course, many of the time, the nutrition supplement might be required.
So actually, this is one of the things that people are saying, that this medicine doesn't just lead to weight loss, but it can also solve multiple other problems that you're facing. It is now being seen as a solution to a lot of neurological diseases, addiction, heart attacks, cardiovascular problems. Are some of these claims exaggerated? Like it's just becoming like the new miracle drug for everything?
No, first of all, it is actually definitely not a miracle, because I think there are evolutions which are happening even in the therapy. There are definitely going to be more and more and better medications. Science as of today is known, and that is what is available. Now, when we look at this particular disorder, and could you please just focus on the question, what exactly?
Yeah, so the question that I'm asking is that when you, even I've forgotten the question now.
Yeah. Yeah.
We both need to take Ozempic,
Yeah.
so neurologically we can be better.
Yeah,
No,
it's a
no,
cure
I'm
for
just remember.
many of the disease. So let me tell you that obesity is the precursor or the reason, directly or indirectly, for 229 diseases from head to toe, including depression, anxiety, gout, osteoarthritis, thyroid, CVD, diabetes, hypertension, you name it, and infertility. Now, this independently is one of the risk factors. So when you try to reduce weight, and we have seen when you reduce even 5% weight, your glycemic level reduces. The blood pressure reduces. With 10%, you can actually delay and avoid type 2 diabetes. You can avoid fatty liver. At 10 to 15% of the weight loss, you can actually start looking at a little bit remission of type 2 diabetes.
Are you saying that most people here should be taking this medicine?
No, I am not. But what I can definitely say is that we were not knowing how much the demand could be. We are actually, Novo Nordisk is basically the powerhouse of protein chemistry. For 100 years, we have been manufacturing insulins. And we definitely take pride that every second person on earth, they take Novo Nordisk insulin. And it's not a new molecule, by the way.
Yeah.
It's GLP-1, the class which is there, it is actually 30 years old. So it is not something new. It might be new in the arena in terms of when people know about it, because some of the celebrities have made it famous. But it is a class which is there for last 30 years. The semaglutide injectable actually is as old as 6 to 7 years in the market. So it's not something new. In India, we launched oral semaglutide. That itself is now 3 years old. So it's not something which is actually coming just around the corner. But it's a molecule which is actually quite old, quite established in terms of getting onto the treatment, first for diabetes, and then we saw the result in obesity, and that result, when it came on obesity, we were surprised that the demand was much more higher than what we actually thought. We should have calibrated that what kind of a demand is going to be there when 1 billion people are getting affected by obesity, and at least an overweight condition.